So today for Susan, we are going to use a full face approach to rejuvenate the entire face, okay? And we're going to start off creating the foundation, if you like, up in the cheek area. So we need to restore some lateral width to the cheek. Then we're going to move along the jawline to restore the vertical dimension to the jawline, which is also going to help us with the jowls. We're going to do some work under the eye area to try and blend the appearance of the bags. And then we'll finish off in the area around the mouth, just softening these folds and creating a little bit more of a youthful shape to the lips. Sound good?
Brilliant.
Have a lie back, please. So here I am injecting the filler into a layer of the face called the smas, which is the layer of the face that's often referred to as the muscle layer because it contains a number of facial muscles. And it's the layer of the face that is also lifted during a surgical facelift. And the reason for injecting into the smas is because when you expand the smas with some filler, it helps to create more lift. So that's one of the reasons that I like injecting this section of the face. It gives us volume, it gives us width, but it also gives us nice lift. Susan has a really thin face, so her face is going to take quite a bit of volume to augment, and that's not something that you should necessarily be scared of using a lot of volume. It's about making sure that the volume is inserted into the right parts of the face so that we're restoring normal anatomy and creating more youthful and more attractive contours. But without trying to change the basic shape of the face, we're restoring. So next I'm going to move on to the middle section of the cheek, the medial cheek, and as well as helping to provide some lift, this also helps to start giving us a little bit of support for the lower eyelid. And I'm just going to work my way around a few different fat compartments in here. And I just like to constantly be reassessing what I'm doing, checking to see that where I'm injecting is having the impact that I'm expecting it to. And I just think I need a little bit more down here in the lateral cheek. I think I need a bit more lift, so I'm coming back down into that lateral cheek fat, and we'll see what this does. Okay. Sit up for me for 3 seconds. Good. And just lie back a wee minute again, please. Okay. So although I've already added quite a lot to the cheek, I still feel as though it needs a little bit more. So I'm coming back into the lateral cheek again. So in total I'm going to have used around about 7 or 8 cc's in the cheeks alone here, which sounds like a lot, but sometimes that's just what you need. And sit up again for 1 second. Okay, good. So far for Susan's face, all I've done is restore some lateral width to the cheek in the smas layer and created a little bit more volume in the mid face. And you can already see that this side of the face looks more lifted than that side. So if you have a look at the appearance of the jowl here, it looks less pronounced than in that side. And already the bag under the eye is starting to look less pronounced than in that side. And that's before we've done anything directly either to the chin or to the eye area. We can see those changes starting to come in. So I'm going to start the work at the chin just by restoring the vertical dimension to the chin again. Really subtle sign of aging, the loss of vertical dimension to the chin. It happens very slowly over a period of years, but actually correcting it can have a really nice impact. When I've finished restoring the vertical dimension to the chin, the next thing that I'm going to do is restore some volume to the white part of the lip. So that's the part of the lip that's below the red part of the lip and above the chin. And again, it's another very subtle place that we lose volume from. And you can just see the tip of my cannula right in that middle section of the lip, white part of the lip now. Really subtle part of the face that we lose volume from, but correcting it can really help to support the mouth area. So we're now going up to the corner of the mouth, and I'm doing that to provide a little bit of structural support to the corner, but I'm also doing that to reduce the negative pull caused by the muscle coming from the corner of the mouth down to the chin. And by placing a little bit of filler on top of that muscle, we weaken the muscle, and that relaxes the corner of the mouth to help it sit up a little bit more. And now I'm just going to move over and do a very similar thing on the other side, using very similar volumes to what I did on the first side. So now I just want to reassess what we've achieved and have an objective look at Susan's face, and I'm still not quite happy with what we've achieved in the cheek. So I'm not going to give up on that yet. I'm going to go back and I'm going to add a little bit more volume into the areas that we've augmented previously, but I'm also going to use a slightly different approach to get into the deep medial cheek fat. And I'm going to do that by coming in from a nasolabial fold access port just here, which is sometimes easier to get access to the right fat compartment I want to target in the midface. And that's the thing about aesthetic practice. Sometimes you really do need to be quite creative and think about, okay, if this isn't quite giving me what I want, how can I do it slightly differently to get us from where we are to where we want to be? And there's that sort of fine-tuning process that's constantly going on and constantly being reassessed. So we've now created some really nice lift to the chin, jowls and cheek area, but these folds are still pretty prominent. So I am going to put some filler directly into the folds, and then we'll see how we are there and what we need to do next. So. Okay. So I'm just restructuring a little bit at the corner of the mouth so that we get a little bit of upturn and less sad look. Good. So I'm just going to have a little bit more augmentation to the white part of the lip. Now you might not realise that this is still part of your lip. People think of the lips as the red part, but the white part between the nose and the chin is also considered the lip. And we often undertreat the lower lip, but actually supporting that really helps to rejuvenate the area around the mouth. I'm now going to move on to blending the junction between the eyelid and the cheek. You can call this a tear trough procedure. Some people do call it a tear trough procedure. Strictly speaking, anatomically it's not, but essentially what we're trying to do is blend that junction. And it's really important to get the patient to open their eyes and look in different directions, because actually having your eyes open or closed or looking up or down makes a big difference to how the lower eyelid actually looks. And we need to keep reassessing it in different directions so that we make sure we achieve an optimal result. And now I'm just going to blend the lid cheek junction on the other side so achieve symmetry. Nice and slowly injecting, checking again for symmetry with the other side and different eye gaze. Thank you. And then last but not least, the lips.
I'm scared how they're going to feel.
They'll feel a bit tender. How did that feel?
Not nearly as bad as I thought.
Good. That's what we like. And what you can see here is that we're not going for a lot of augmentation. We're literally just trying to soften the lip, give a little bit more volume, but really it's a sort of soft, youthful look that we're going for rather than a big pout. And that is us.
Wow. That's amazing. Gee. That's fantastic.
Happy with that?
Super pleased, yeah.
Good.
Yeah.